ICU refused antibiotics, but we were planning home ventilation with intensive care at home. My name is Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for adults and children on BiPAP, CPAP ventilation without tracheostomy, tracheostomy care without ventilation, home TPN, home IV potassium, home IV magnesium, home IV antibiotic infusions, home cough assist management, IV or central line, PEEK line, Hickman's line, port management, as well as nasogastric tube, nasojejunostomy, PEG tube, patch tube management, ventilation weaning at home, and palliative care at home as well. So today I actually want to share a very real story from a family who reached out to us because no family should ever have to go through what they went through in ICU and where intensive care at home comes in. So the plan for this family, for their mother, was very clear. She was in ICU for months on end. She had a ventilator and she had a tracheostomy. She was ventilator dependent and couldn't be weaned off the ventilator. So she was then eventually only in ICU to stabilize on the ventilator, set her up with settings to go home, and then transition home safely with intensive care at home, fully supported by our 24/7 intensive care nurses. The ICU's medical director was on board and our team was ready to train and support the transition home, following the mechanical home ventilation guidelines that are evidence-based and are published on our website at intensivecareathome.com. Everything was arranged, the ventilator, tracheostomy care, and 24/7 critical care nursing team at home. We had everything ready to go. Then the situation changed. The patient developed a high white blood cell count, clearly indicating an infection. The family rightly requested antibiotics, but the ICU team refused to give them and instead suggested taking the patient home and turn off the ventilator after just a couple of days. Understandably, this family was horrified. Their mother was awake, trying to talk, and wanted to live. And the family refused to give up. They knew she needed antibiotics, not a death sentence. Here at Intensive Care at Home, we of course supported this family with the right information to prepare for safe home ventilation with our team, tracheostomy and 24/7 critical care nurses. We know from experience that patients are much safer at home than in ICU, especially once they're medically stable and are off inotropes and vasopressors. Why? Because at home there's much less risk of infection, especially compared to ICU environments where infection rates are running rampant and are much higher due to multiple invasive procedures and exposure to other highly infectious, critically ill patients. Moreover, patients at home on ventilation with tracheostomy enjoy a much better quality of life, surrounded by their family, sleeping in their own environment, and engaging in daily routines that they decide on instead of being stuck in a noisy ICU environment. Families don't need to feel powerless or pressured by ICU teams pushing for end-of-life decisions when there is a real, safe, genuine, legitimate, and most importantly, evidence-based alternative like intensive care home. Once again, our service follows the evidence-based mechanical home ventilation guidelines, ensuring the highest level of safety, infection control standards, and clinical excellence in the home care environment is maintained. We're also the only service provider in 2025 in Australia that actually has achieved third-party accreditation for intensive care at home, because that takes years of experience, trial and error, and also building the intellectual property that is needed to create a safe, caring environment. So, if your loved one is ventilated in ICU with a tracheostomy and doctors are saying there's nothing else we can do, or you can't go home, please reach out to us before making any decisions. You can contact us on one of the numbers on the top of our website at intensivecareathome.com, or you can send us an email to info@intensivecareathome.com if you need help. We can help you bring your loved one home from ICU safely and with dignity. Now, with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care, tracheostomy care for clients without ventilation, home care services for patients on non-invasive ventilation such as home BiPAP, home CPAP, home TPN, which is also known as IV nutrition, home IV potassium and home IV magnesium infusions, IV fluids, and IV antibiotics. We are providing central line management, PICC line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home, the use of cough assist machines for our clients for airway clearance at home, palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day, and we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families and by a team of dedicated intensive care nurses in the home care setting instead of in an intensive care unit. With intensive care at home, we are currently operating all around Australia in all major capital cities as well as in all regional and rural areas. We work with NDIS clients all around Australia, TAC and WorkSafe in Victoria, Department of Veteran Affairs all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are having policies and procedures for intensive care at home nursing, and we've built all the intellectual property for intensive care at home since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. So if you're at home already, and if you're watching this, or you're stuck in an ICU long-term, or if you're going to hospital and ED all the time, and you realize that you don't have the right level of support at home, or if you are stuck in an ICU, I'll give you a real-world example today how we can help you. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a client at home on a ventilator with a tracheostomy. That is dangerous and it's simply negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of dedicated critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So this client at the time found out about us eventually, and the ICU that he was basically living in also knew about us and eventually reached out to us. And we were proving our concept with this client very fast. When we worked with this particular client, we sent him critical care nurses 24 hours a day, and he never ever went back into ICU ever again as long as we were working with this client. We can do the same for you if you're not safe at home and help you with keeping you at home predictably. Otherwise, we would not be in business. Again, the same is applicable for those stuck in an ICU, similar to this case study that I've just given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. If you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you need more evidence for nursing care, we are also writing NDIS nursing assessments with legal nurse, critical care consulting nurses. If you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. You can join this high-performing team if you are a critical care nurse. If you are looking for a career change as a critical care nurse, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are so vulnerable and so special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building solid relationships with us and with our clients. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients, or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or for home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US and in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.